Very good evening to all of you. And at the outset, I would like to thank organizing committee of the SPEEDCON for this opportunity, which is a indeed pleasure and privilege to talk about your teachers in their presence or in their absence. So I am really very thankful to SPEEDCON team and Dr. Samir especially for giving this opportunity to talk about Dr. Dash and his life. I had the opportunity to interact with Dr. Dash as a senior resident and then a brief tenure as a faculty with Dr. Dash at PGI Chandigarh. Lot of things to talk about Dr. Dash, but maybe I'll try to cover in given time 30 minutes few important highlights of his life as a teacher, as a guide or as a colleague or as a mentor. Dr. Dash, born in Odisha, a small village, very humble beginning. His village is a school up to the 4th standard only. Born in 1941, and we lost him last year in August 2021. So as I mentioned, he was born in a small village near Cuttack, and his journey from Cuttack to Chandigarh initiated. But though he born in a small village, but he was visited almost all major department of the world in the field of endocrinology. So he was visiting professors for more than 30 institutes of the world. Going to his name, that Radha Raman Jiban Das, actually there is a story behind that. The word Jiban is brought into that because he had post-measles recurrent pneumonitis. So that some god man given the name that Jiban added. So to survive, that was something like it happens in many places earlier time. So that is how his name came as the Radha Raman Jiban Das. I think at least with relation to Indian endocrinology, he was the pioneer person to start the Endocrine Society of India. He is the founder member of the Endocrine Society of India. He was an incidental endocrinologist. After finishing his MD at PGI Chandigarh, so he was interested in cardiology actually, and so he met with the professor of cardiology at PGI to join as a registrar in his unit. But then director of PGI, Dr. P.N. Chutani, asked him, why don't you join Dr. Rastogi, that they are developing or initiating a department as endocrinology, so you join the endocrinology. So how his journey from cardiology to move to the endocrinology. So his academic journey was like MBBS did from the Cuttack Medical College. He did his MD from PGI Chandigarh in medicine. He did DM from PGI Chandigarh. He was registrar in endocrinology, then became lecturer, then became head of department after Professor Rastogi migrated to USA, and he retired as a dean research from PGI in 2003, September 2003. So he served almost 37 years to the institute, and his residency started in 1966, and he's finished as a professor and head as well as the dean research from PGI, and retired as 2003. He has several first thing to his credit. He is the first DM in the country, first DM in endocrinology, first dean of PGI. He was the youngest professor of PGI Chandigarh at the age of 42 years, and he helped to establish department of endocrinology at PGI Chandigarh with Dr. Rastogi, and he was actually father figure for many senior endocrinologists of the country. So many first to his credit. He received various prestigious awards. To name few of them, he received B.C. Roy Award, and he received multiple times ICMR Award in various names of the ICMR Awards. He was also awarded Fellowship of the Royal College of Physicians, and with citation it read like that, Professor Radha Raman Jiban Das, the senior professor of endocrinology from PGI Chandigarh. India is ahead of its time. In honoring him, RCP London is honoring itself. So it was citation on his fellowship of Royal College of Physicians. So he was felicitated by several organizations and personalities of his pioneering work in endocrinology, like International Medical Science Academy, Indian College of Physicians. He received multiple time ICMR award and various other awards. In addition to that, he also received the various fellowships all over the country. He in his lifetime 3 times received the award from the president, first in 1992 as a outstanding services rendered to the people of India, then in 1993 BC Roy Award, and in 2011 his pioneering work in scientific contribution to the field of the endocrinology in India. So receiving award from various presidents of the India. And I think maybe interested to know that DRC, Dr. Yalo is there. She set up the first RIA, and he briefly worked with him, like Dr. Kochupille also worked with Dr. Yalo in the New York. So he has a opportunity to work with the Dr. Yalo, who's established first radio immunoassay, and that was with relation to the insulin measurement. So as I mentioned earlier already, he had a very illustrious career and in field of endocrinology, and visited many countries and delivered various orations, not only in India but outside India. And he was the visiting professors for many countries and in many places. He was a teacher of the teacher. He trained over 70 DM residents and fellows at endocrinology PGI Chandigarh. And most of his students are actually currently heading the department of endocrinology. So he was you can say the guiding force for many senior endocrinologists in the country. And he produced at that time, the DM was very few places. And as I remember, maybe very few seats were there for endocrinology. So those who were trained under Dr. Dash, they feel proud and privileged that training was really tough. With relation to ESI, Dr. Dash was founder member of the Endocrine Society of India, and he was past president of Endocrine Society of India. Coming to the research, for a teacher working in an institution, there are 3 important qualities are required. One is research, second, of course, the clinical care, and third one is teaching. I think Dr. Dash fulfilled all 3 commitments with the great extent, and we can say is the little master of the Indian endocrinology indeed. You see his publications, back-to-back publication in the JCM. Even today, when we feel that somebody published in JCM, we congratulate, okay, good, this is published in JCM. So in 1974, back-to-back publication in the JCM, 1974, 1975, 1976. So that was a great acumen, and the research aptitude was there to publish in JCM in the 1970s. Few years ago, now actually the endocrinology's 2 parts were there. One was clinical endocrinology, and the second was the endocrinology related to the laboratory. With the availability of the new assay techniques, especially ICLIA, the laboratory part is relatively missed from our teaching also, and maybe young endocrinologists not that keen because all assays can be done easily with ICLIA. As compared to maybe we go back 20 years, there was a posting in the endocrine laboratory for 3 to 6 months of all the residents to set up the radio immunoassay. And so Dr. Dash has a privilege, or you can say this publication is somewhere in 1975, and he established specific non-chromatographic radioimmunoassay for human plasma cortisol, and that same was published in the steroid. So that says that how he was good in, not only the clinical research, but in the field of basic science, and established a new assay that was related to the steroid. So he was achieved the lifetime achievement from contribution to diabetes and endocrinology from in Odisha. It is always privileged to acknowledge by their own people. That is always people will like to enjoy that, and that he has a credibility till end to achieve the get the achievement from their own people from Odisha. After his superannuation 2003 as a Dean Research from PGI Chandigarh, and indeed he was a director on that day, though it was on the ad hoc basis only because there was no permanent director on that. This was when he was coming from the Cairo block, that is the our administrative block of the PGI Chandigarh. He came down around 4 o'clock or 5 o'clock as a retiring as a director, though it was not a permanent director. So, and he was remained academically active even after the superannuation, and he was attending various conferences and giving his comments and all. Now briefly about role in my career building of Dr. Dash. So indeed he guided when I joined as a faculty in 2002 to PGI Chandigarh. He asked me to write a project on type 1 diabetes. Though that project was not approved from any what you call extramural grant, but it was approved from the intramural grant, and we kind of initiated collecting the information on type 1 diabetes. And till date I have interest in type 1 diabetes, or more say the diabetes in young. That was an important say step in my career with relation to type 1 diabetes. And then coming to the metabolic bone disease, indeed I love reading, talking and speaking about the metabolic bone disease in various forms. And Dr. Nikhil Tandon is here, and if you can recall in 2003, we had a first ISBMR meeting. So initially ISBMR meeting, that is Indian Society for Bone and Mineral Research meeting, is attached to the Endocrine Society meeting for half day or 1 day. But in 2002, we had a indeed 3 days meeting on the bone, and that was a great step or the great support in my career to work in the field of metabolic bone disease. And I'll subsequently inform you that how this particular conference helped me to work in the field of metabolic bone disease. So these are two great things which happened to me in my career because of Dr. Dash, is that one is working in the field of diabetes in young, and second is the metabolic bone disease. So that was the Indian ISBMR 2002. This is my 2002 photograph, and with Dr. Dash first photograph as he joined the DM in endocrinology at PGI Chandigarh. So in that 3 days meeting of ISBMR, participated by the renowned endocrinologist as well as the person, those are who is who in the field of bone and mineral metabolism. Dr. S.P. Teotia was there. Professor D.S. Rao from Henry Ford Hospital, he was there. Professor Mittal was there, and Professor Tandon was there in that meeting for the ISBMR 3 days meeting. Very important thing that actually helped me to build my career is to introduction to Dr. D.S. Rao in that particular conference. So he was for a short period for 2 days, and he came from US to attend that meeting only, and somehow had opportunity to interact with him being an organizing secretary for that meeting, and I had an interaction with Dr. Rao. So I keep mailing him after once he left he reached to the Henry Ford from after attending the ISBMR. So initially he was not answering most of the email, but somehow he understood that I am not leaving him. Keep sending emails, some patient details, this, that, and probably must have discussed with our senior ISBMR fraternity, maybe Dr. Mittal or Dr. Tandon, that who is this, is talking on this. Then that is very such a nice association established with Dr. Rao that I'll often tell him is my ex-India mentor and my friend, philosopher as well as guide. And because of that meeting, I had the opportunity to serve ISBMR in various capacities as executive member, as joint secretary, and the secretary for 2 tenures. And because of Dr. Rao, we all know that at least endocrinologists, young or the senior endocrinologists, know that he is one of the father figure in the field of primary hyperparathyroidism. and in various guidelines is featured, and recently is not featured, but his various papers, the pioneering work is actually quoted by these hyperparathyroid guidelines. And because of him, I had an interest or developed interest in PHPT and subsequently made a registry that was first online registry on primary hyperparathyroidism. And in this registry, many people from all our country are actually participating. And this registry having approximately 1500 patients data on primary hyperparathyroidism. And that is a very detailed information. And this registry is approximately having around 300 variables on various information related to the primary hyperparathyroidism, and it is a very, you can call it is recognized registry in the world, because I don't think there is similar type of registries available with this such detailed information. And I request or urge the people, young people, those are having patients of primary hyperpara, they can add to this registry and we can have more publication on this registry. Similar to the ISBMR, because I had the opportunity to present on the Paget's disease, so I developed made a paper on Paget's disease in India. Does it exist? So that is very first paper. The patient was 21. From PGI, just 4 or 5 patients were there, but you can see this authors from the various other places are there. Dr. A.G. Kunni Krishnan, Dr. Khadgawat, when he was working at that time in the Nizam Hospital, Hyderabad. Dr. S.K. Singh from BHU, and Mittal sir had some patient from, I think, Apollo Hospital, and some patient from the Northeast also. So, because of interest in primary hyperparathyroidism, establishing the Indian PHPT registry on primary hyperparathyroidism, and had the opportunity to work in basic science and have few PhD students, those are working in the field of primary hyperparathyroidism, and we had a back-to-back publication that is related to the primary hyperparathyroidism and metabolic bone disease. So I must say that what looking at the Dr. Dash publication is inspired all our young colleagues to work in this field, and we are able to achieve similar few information on that. He was a tough taskmaster. Those are in this hall taught by Dr. Dash. They know how tough he was and how punctual he was. I recall one incident, Dr. S.K. Sharma from Jaipur, he was doing DM there. Early morning in December month, huge fog was there, very difficult to reach to in that dense fog. And he thought that today the seminar will be cancelled on Saturday morning. To his utter surprise, he has to present. He thought today seminar will be cancelled. But before he reaches to department in the endocrine laboratory, Dr. Dash was sitting there. So he was so tough taskmaster and very particular with academics. His clinical approach, he was sitting in OPD till 5 o'clock in 2 OPD days in the our Wednesday and Thursday at PGI Chandigarh. Very good in making the decision. And I remember his sentence, he was very upset when he see that patient came in horizontal and going vertical to the department because of some or other reason. So always a class on that, why, how it happened and all these things. So he was very concerned about the patient also. Helpful for the student, there is no doubt about that, and that's why the people achieved the heights because of his guidance, because of his support, because of his training. And he was mentor for many of us in this hall even, and I guided many people. Punctuality is great virtue, as I mentioned, given an example. He was in the various posts because of senior professor at the PGI Chandigarh, but he reaches to the journal club or in the seminars on dot before anybody reaches, so that we have to reach before time, actually 5 minutes, because otherwise it will be difficult. You are entering into the room and when already your professor is there. So that is a one important, his habit was there of related to the punctuality. And another important thing PGI has, that is the clinico-pathological conference. And PGI, to his credit, is having around 30,000 autopsies. And he was, there is a program that is called CPC for the faculty that is there on every Wednesday. And again very punctual, whatever outside the fire is there or the rain is there, that will start 8 a.m. in the morning. So he was chairing that session for almost 10 years. because he's the senior most professor and the, say, Group B department, what you call, we call it is a chair of the Group B department that comes all medical departments, medicine departments. He was, of course, clinician par excellence. He established and encouraged the importance of astute clinical examination in branch earlier known for investigation-based branch endocrinology. He was officiating dean at PGI Chandigarh. So the legacy lives on. He is survived by his wife, Professor Sumitra Desh. She was the head of department hematology PGI Chandigarh, children's and grandchildren's, and nonetheless various students all over the country as well as outside the country, and the innumerable grateful patients for his taken care by Dr. Dash. And currently the department has 7 faculty and residents and PhD scholars. So thank you very much for the patience listening. I'll just say he was a little master of Indian endocrinology. Thank you very much.
Thank you, sir. Thank you, sir, for going through the life journey of Professor Dash, sir. It was really impressive. I request Professor M.K. Garg, sir. Dr. Garg, sir, please. Dr. M.K. Garg is Head Department of Medicine and in charge endocrinology at All India Institute of Medical Science, Jodhpur. Sir, I would request to please felicitate Dr. Sanjay Bhadada, sir, with a memento. Thank you.